In February 1886, the most famous neurologist alive described a strange new disease and got its anatomy completely wrong. 3 months later, a far less famous doctor described the exact same disease, independently, and got it right. Medical history eventually named the condition Charcot-Marie-Tooth disease, splitting the credit equally among all three men. But it would take 105 years and the discovery of a specific genetic mechanism no one had previously described to finally prove the least famous of them was correct. The next century of medical research would follow the path laid by the most influential name in the room, while the correct anatomical explanation remained a historical footnote. To understand what they were looking at, picture your own peripheral nervous system. The nerves that control your feet have to travel to furthest distance from your spinal cord. In Charcot-Marie-Tooth disease, those longest fibers are affected first, a pattern called length-dependent neuropathy. Because the longest fibers fail early, symptoms typically start in the lower extremities and slowly climb. First, you might develop high-arched feet, known as pes cavus, along with curled hammer toes. Eventually, you lose the ability to lift your foot, causing a high-stepping gait. As the calf muscles waste away while the thighs remain preserved, the leg takes on a distinctive tapered shape, often described as an inverted champagne bottle. Over years, as the disease progresses up the limbs, the hands and forearms weaken too, sometimes leading to claw hand deformities. Today, this specific progression makes it the single most common inherited peripheral nerve disorder in the world. Identifying the disease is the first step, but doctors must determine how the nerve is failing. They classify the condition into two main types. In CMT1, the fatty myelin sheath insulating the nerve is the primary target of damage. In CMT2, that insulation is fine, but the internal nerve fiber itself, the axon, is deteriorating. They can tell these two apart without a genetic test by using a nerve conduction study. They send a tiny electrical pulse down the arm or leg. If the myelin insulation is damaged, that electrical signal travels significantly slower than normal. If the inner axon is failing, the signal moves at a normal speed, but arrives noticeably smaller, because there are fewer working fibers left to carry it. The physical symptoms map where the disease is occurring in the body, but those electrical signals reveal which structural component of the nerve is failing. In February 1886, a neurologist named Pierre Marie and his teacher, Jean-Martin Charcot, published a detailed description of 5 patients with these symptoms at the Salpêtrière Hospital in Paris. Working from the world's preeminent center for neurology, Charcot's influence was so vast that his students and peers accepted his spinal cord theory as the standard medical framework for the disease. 3 months later, in May 1886, Howard Henry Tooth was finishing his medical thesis at Cambridge and studying the exact same clinical picture. Tooth reached the opposite conclusion. He argued the spinal cord was healthy and the damage was strictly in the peripheral nerves themselves. He even noted the timing in his thesis, writing that the disease was recognized almost at the same time and quite independently by the researchers in Paris and himself. Tooth's anatomy was correct, but Charcot's fame meant the spinal cord hypothesis carried more scientific weight. It would take decades of pathological work to finally validate the conclusion of the less prominent doctor. In 1991, James Lubsky's team and an independent Belgian team finally uncovered the true molecular cause of the most common form of the disease, CMT1A. On chromosome 17, an entirely duplicated 1.4 megabase DNA block introduced the gene dosage concept, disease caused by wrong quantities of a functional gene. Patients with 3 PMP22 copies produce 50% more protein, severely disrupting myelin. Missing that block makes nerves vulnerable to pressure. These discoveries established that disease can be caused simply by a perfectly healthy gene being present in the wrong number of copies. Currently, there is no cure for Charcot-Marie-Tooth disease. Management relies on supportive care, physical and occupational therapy, custom orthotics to correct foot drop, and orthopedic surgery for joint deformities. Mapping the precise gene dosage of PMP22 has provided a specific target for researchers to develop drugs that aim to correct the protein levels directly. A confident wrong answer from the most famous hospital in the world. A quiet right one from a doctoral thesis nobody was watching. It took 105 years and a gene dosage discovery to finally prove which one was true. January Science tells the story behind the science, one disease at a time. Subscribe today.